Hi there, I'm Taylor Kappelman, and I'm an Associate Clinical Specialist here at Medtronic. I'm excited to be walking you through an overview of atrial fibrillation, or AFib, and how we support its treatment with advanced ablation technologies. Today, I'll cover what AFib is, how it affects patients, and then transition into our treatment portfolio. Before I dive in, what do you already know about AFib? Have you seen it in the lab before or worked with patients who have it? That's great. Let's build on that knowledge together. So let's start with the basics. What exactly is atrial fibrillation and why does it matter? AFib is the most common sustained arrhythmia where the heart beats irregularly and often at an increased rate. It occurs when the atria, the upper chambers of the heart, start to beat rapidly, out of sync with the ventricles. This can disrupt normal blood flow and lead to complications like blood clot, heart failure, and stroke. Some patients don't feel any symptoms, while others may experience fluttering, fatigue, or dizziness. If left untreated, a patient with AFib is 5 times more likely to experience a stroke, so it is important that they are treated promptly and efficiently. Now that we know what AFib is, let's look at what's happening inside the heart to cause it. In a healthy heart, a group of cells in the right chamber, the sinoatrial, sends regular electrical impulses that begin each heartbeat. These signals move across the upper chambers and arrive at a group called the AV node, where they slow down and move to the lower heart chambers. However, in AFib, the signals generated in the upper chamber become chaotic, and the atria trembles instead of contracting properly. The AV node gets bombarded with impulses, causing the ventricles to beat irregularly, sometimes up to 175 beats per minute. This is usually due to structural changes in the heart, but can also be triggered by other health issues that you can see on this slide. Fortunately, there are multiple ways we can treat AFib and manage these risks. Today, I will walk you through our suite of cardiac ablation and mapping technologies. As you can see in the image, we have 4 different types of catheters. In addition, I will be discussing 2 types of mapping systems and the Achieve mapping catheters. For each product, I will describe what it is, why it is used, and go into a little bit of technical detail. To kick us off, we have the Affera mapping system. Affera combines mapping and ablation in one catheter, which saves time and improves accuracy. You can switch between RF and pulsed field ablation without changing catheters. It's great for complex substrate work or persistent AFib requiring advanced visualization. Now, let's explore Medtronic's newest energy modality, the pulsed field ablation. Pulse Select uses pulsed electrical fields to ablate only myocardial cells, sparing other tissues. This makes it great for patients where esophageal or phrenic nerve injury is a concern. It's a promising new technology with a growing safety profile. For situations where precise radio frequency or RF control is needed, we turn to the diode-temp system. The diode-temp gives operators better control by directly measuring the tissue temperature. That means more efficient lesion formation and reduced risk of overheating. It's ideal when using high-power protocols or in tissue where overheating would be risky. Arctic Front simplifies pulmonary vein isolation using cryothermal energy. Instead of ablating spot by spot like RF, it creates a full circular lesion with one freeze, reducing time and variability. It's ideal for high volume AFib cases where consistency and speed matter. For more focal ablation needs, Medtronic offers the Freezer Cryo family. Freezer is used when you're ablating smaller targets like the AV node or CTI. Cryo is gentler on surrounding tissues and allows you to test the site with cryo mapping before committing. It's a great option when precision and safety near the conduction system are key. Supporting both Freezer and Arctic Front are Medtronic's mapping tools, specifically the Achieve catheters. These catheters allow us to record PV potentials during cryoablation. They help confirm that we've electrically isolated the vein. The Achieve Advance has improved torque response, making it easier to manipulate. And before we even need to place a catheter, Cardio Insight helps us map the heart non-invasively. Cardio Insight helps visualize the arrhythmias without placing a catheter in the heart. It's particularly useful for redo procedures or patients with unclear arrhythmia sources. By combining surface ECG with mapping, it creates a clear map to guide the strategy. So, across mapping, ablation, and support tools, Medtronic offers a full and flexible solution set. Atrial fibrillation is the most common sustained arrhythmia and one of the most serious. But the good news is, with early intervention and the right tools, we can make a huge impact on patient outcomes. With all of that in mind, I just want to say thank you so much for your time and attention today. I'm truly excited about the opportunity to work alongside Medtronic's clinical team and provide support providers like you in bringing cutting edge solutions to the EP lab. Please let me know if you have any questions. As always, I'm happy to connect further and continue learning from you. Thank you.